Hello, my name is Autumn Hoffman, and this is Module 5 for MIT 822 course. Talk about visualization and cognitive load. So I've used a Google presentation here to make a quick presentation to help you compare what a cluttered visual looks like versus a well-organized one. So this first one, as you can see, is very cluttered. There's a lot going on. We have terms, we have 4 different pictures representing 4 different ways that we can do traction. There's a lot going on, and our brain wasn't intended or designed to process the information in this format. The cognitive overload theory structures on how we need to have a kind of a clear and concise and workable and relatable information, and for me this isn't as clear as this next slide. It's clutter-free. We have just 4 main things going on. We have traction, telling us this is who's pulling, versus distraction, telling us this is what's separating. And from this picture we can see the difference between the 2 terms, and what it's doing and defining the terms as well. And from here we can take it to that next step and level of thinking to what structures are being distracted in this, and we can pull in the student's previous experience from their anatomy class, from the other instructor in the program, and really hone in on taking that experience into a multiple different levels of learning and how they will use this information towards their patients. So this is kind of built on the theory of 3 things: chunking, making sure that the information is presented in bite-sized chunks. So you can see in the first slide that it was like a whole pizza right there, but then we broke it down into one nice slice of comparing the 2 terms. And we use very simple, clear, and concise visuals to help identify that the machine is pulling, and then it's the structures that are distracting and separating. And then we use those to connect the dots and bring this information all together by pulling in that anatomy slide and how we can use that and pull these pieces together for the students, and how traction relates to the anatomy and to choosing the correct parameters when you go through the whole presentation. So it's important, I believe, for us to make sure we keep these simple and yet complex, but not in an overwhelming manner. So I thank you.